The modern rush to embrace designer NAD boosters like NR and NMN has overshadowed niacin's unparalleled record as both an essential vitamin and a powerful therapeutic. Yet, a rational, science-driven approach to NAD optimization doesn't need to frame these molecules as rivals. Rather, it should place niacin at the foundation, with other precursors layered in selectively based on emerging evidence of unique targeting or bioavailability advantages. A unified model starts with recognizing niacin's central strengths, its long-established safety profile at both nutritional and pharmacological doses, its affordable and scalable production, and its entry into the NAD biosynthesis network via the price handler pathway. This pathway offers a critical advantage. It bypasses NEMPT dependence, which can be impaired in aging, obesity, or chronic disease scenarios where NAD needs are often highest. Unlike NR or NMN, niacin can restore NAD even when salvage pathway flux is compromised, making it a more reliable baseline replenisher across diverse populations. In this model, niacin becomes the universal starting point for NAD support, a simple, evidence-backed intervention to correct deficiencies or sustain NAD pools in healthy and diseased tissues alike. For most people and many clinical contexts, niacin alone may be sufficient to maintain or elevate NAD to levels supporting metabolic health, DNA repair, and healthy aging. Where do NR and NMN fit? They can occupy a conditional, complementary role. Targeted bioavailability. If robust human data ever show that NR or NMN reach specific tissues, e.g., certain brain regions, failing heart muscle, more effectively than niacin, their use could be justified for precise interventions. For now, such tissue-specific advantages remain theoretical and unproven in humans, but it's an area where future imaging and tracer studies could provide actionable insights. Acute or localized depletion. In cases of extreme, tissue-specific NAD loss, e.g., after ischemic injury, neurodegeneration, or chemotherapy-induced neuropathy, NR/NMN could be deployed as short-term intensifiers layered on top of a niacin base, provided clear evidence emerges of superior kinetics in these settings. Formulation breakthroughs. If advances like liposomal or mitochondria-targeted delivery systems for NR/NMN can show consistent, clinically meaningful effects beyond what niacin achieves, they could be added to protocols already centered on niacin. But until such delivery advantages translate into real human outcomes, niacin should remain the first-line choice. This integrative framework also promotes safety. Niacin side effects, primarily flushing, are predictable, manageable, and well-studied, unlike NR/NMN, where long-term safety data are sparse. By limiting NR/NMN to defined situations with demonstrated benefit, we avoid unnecessary exposure to expensive, less proven molecules, and reduce risks of oversaturating NAD pathways or accumulating nicotinamide (NEM) and its methylated metabolites, which could tax methylation capacity over time. Furthermore, this unified model acknowledges the economic and global health dimensions. Niacin's affordability and proven infrastructure make it accessible in low-income settings, where nutritional NAD deficiencies remain a threat, and where age-related NAD decline contributes to the growing burden of degenerative diseases. In contrast, widespread use of costly NR/NMN supplements risks deepening health inequities without guaranteed added benefit. Lastly, centering niacin supports scientific transparency. It redirects the conversation from marketing hype to rigorous comparative research, encouraging investigators to test whether NR/NMN actually outperform niacin in well-powered, long-term human trials, the only context in which paying more for designer precursors can be ethically and medically justified. A unified NAD strategy should restore niacin to its rightful role as the cornerstone precursor, cheap, effective, globally scalable, with NR/NMN reserved for precisely defined indications where clear superiority is demonstrated in humans. This integrative model balances cost, safety, accessibility, and mechanistic biology, ensuring NAD restoration becomes a rational, equitable, and evidence-based component of healthy aging and disease prevention.